Well, thank you, Catherine. As women, we're always trying to get our health in check, but we want to make sure our hormones are balanced. And here to help us out is Dr. Gary Donovitz, and he is the founder and CEO of BioTE Medical. Nice to have you here.
Thanks for having me.
This is going to be a lot of fun because this information is so vital, especially for women. We're trying to get our systems in balance. Every woman wants to be healthy, lose some weight. So tell us a little bit about hormone therapy, because it's been around for a while, but a lot of people don't know about it.
Yeah, hormone therapy has been around for a long time. In fact, what we do with little small pellets in terms of optimizing your hormones has been around for 80 years. It's used in 5 continents. The thing is, most people don't know how to optimize their hormones. They've just been given either pills or patches or creams that don't work, and then they give up.
And I see that we have a picture here. That's the actual size of the pellet. It's so small.
It's just like a grain of rice, and actually smaller on the estrogen. So the testosterone's about the size of a grain of rice, and the other's much smaller.
So how is this applied?
So what we do is we actually put it back here in the hip. It doesn't hurt going in. For most women, they do it 2 or 3 times a year. That way we get the hormone levels constant, so you're not on a roller coaster ride. If you put creams or pills or patches on, your hormones are going up and down, and women don't do well with hormones swinging up and down.
That's very important. All right, so tell us a little bit about the difference between the bioidentical and the synthetic hormones, because I've heard of synthetic but not bioidentical. What's the difference?
Right, so what we use is all bioidentical, whether it's testosterone or estradiol or thyroid, and they're all plant-based for the testosterone and the estradiol, meaning they come from yams.
Nice.
And then we make a hormone that looks exactly like the hormone your body made. So when we administer the pellets, you're getting the same hormone that your ovary made your whole life, and in men the same hormone the testicle made the whole life. So your body doesn't see something that's abnormal, and you get a much better response.
Well, that makes a lot of sense. Thank you for clarifying that. Let's talk about what's something I saw on your website, and I said to myself, this is pretty interesting. You said that using the pellet method can change the manner in which a woman ages. How so?
Well, people are always going to age. I don't really believe in anti-aging. I don't believe in reversing aging. But if you could age healthier so that no matter how old you are, you felt better. We do that by optimizing your hormones. So your energy is better. You can lose weight. Your brain function is better. That memory, focus, and concentration. You don't have the depression, the anxiety. You actually sleep better. Your sex drive is better. So your home life is better. Your work life is better. That's what I'm talking about in terms of improving quality of life for people with hormone optimization.
So it's very important that you do get this level playing field so you understand that you don't have to be on that roller coaster. And I like your book, it says Age Healthier, Live Happier, Avoid Over-Medication Through Natural Hormone Balance, because that's another key thing. People are over-medicated.
Sure, as people start getting depression, they don't feel well, they get on antidepressants, then they gain weight, then they get on diet pills and fad diets, then they get on drugs to lower cholesterol that make them feel worse. And it's actually not good. What we do at BioTE, by optimizing your hormones, protects your brain in the long run. You reduce your risk for Alzheimer's. Most important, you reduce your risk for breast cancer, and you reduce your risk for heart disease. Heart disease is the #1 killer for women, and we've done nothing to reduce that over the years. This actually will reduce it significantly.
Again, reiterate, how often do you have to have this done once you get the pellet put in?
Once you get the pellet put in, we repeat that about every 3 to 4 months. That's all. So you do it 2 or 3 times a year. That's it.
Okay, and how often or how long does it take before you actually feel the results and start seeing the results in your life?
Within a week. You will feel it within a week.
That's fantastic.
Yeah.
All right, if you'd like more information, I'm going to send you to the website right now. It is biotemedical.com, and we're also going to have a link on our website, aztv.com. We only have about 30 seconds left, so tell us real quick, what is the one thing that you want people to take away, especially the women who are watching the show today? Well,
we have BioTE certified providers in this area who can do this for you and change your life. It's about changing healthcare and changing people's lives. And by the way, we've just looked at a study of what our patients have done in breast cancer, 60% reduction in breast cancer. So if you want to lower your risk for cancer and lower your risk for heart disease and feel better, I think this would be a great opportunity.
You were fantastic. Thank you for being here. This is Dr. Gary Donovitz. Again, the information for BioTE Medical will be on our website, aztv.com. Get those hormones in balance and live the life that you were meant to live. Don't go anywhere. When we come back, we're going to have plenty more for you here on Arizona Daily Mix.